Hello everyone, welcome to my YouTube channel Pharma Researcher. So today we are going to discuss another model test paper for Telangana Pharmacist Grade-II exam preparation. So this in this particular series we have discussed 10 different units as per the syllabus, and now we are discussing the different model test papers based on those MCQ questions which we have already discussed. So the question paper will be designed based on the syllabus or pattern. Like there are total 80 MCQ questions, and you have to answer those 80 MCQ questions based on the pattern. The questions are equally distributed among the 10 units. So here, if you can see the written examination details, so there will be a computer-based test for the exam. 80 NCQ questions will be there. Each question will carry 1 mark, and the computer-based test is on 30th of November 2024. So only 2 days are remaining. So we can discuss more. We have already discussed 3 model test papers. If you haven't watched those, if you haven't followed those, so you can check those other 3 model test papers. I have mentioned the links in the description box. You can simply watch those and practice yourself. So in order to solve these mock tests, you can follow 2 different techniques. Like first one is, like I have provided you the PDF of the MCQ questions of 80 MCQs. You can simply download the PDF. You can solve the questions out of 1 to 80 MCQ questions are there. You can mark all the answers for these 80 MCQ questions. Then you can come back to this particular video, check all the answers from this particular video, and get your marks out of 80. Whatever you get, whatever the correct answers you will be getting, you can mark those answers. Second is, continue with this particular video. I will be mentioning the questions with options. I will be mentioning questions with options. You can simply follow the questions wherever you require to take time on that particular question. Just pause the video. You can solve that question, mark your answer, and then check the particular answer. So out of you can have a paper. You can mark this paper out of from 1 to 80. Against each question you can mark your answer, check the answer. If it is correct, then it is fine. If it is incorrect, then there will be 0 marks for that question. And after completing 80 MCQ questions, you can check like how many questions are correct. That will be your marks. You can mention those marks in the comment section, and compare your marks with other candidates whosoever has mentioned the marks, and in that way you can evaluate yourself. So let's start with the first question. So the question is, the word pharmacopoeia is derived from the Greek words pharmakon, which means a drug or medicine, and poia means. Options are to make, to determine, to evaluate, or none of the above. And the correct answer is option number A, to make. Then the next question is, sulfur used as additive in rubber packaging material acts as. Options are elastomer, vulcanizing agent, accelerator, or filler. And the correct answer is option number B, vulcanizing agent. Next question is, according to Indian Pharmacopoeia, British Pharmacopoeia, very fine powder is one of which. Options are all particles pass through sieve number 120, 90% particles pass through sieve number 350, all particles pass through sieve 50, 90% particles are of size less than 10 micrometer. The correct answer is option number A, all particles pass through sieve number 120. Next question is, signature is the direction given to. Options are prescriber, pharmacist, patient, or manufacturer. And the correct answer is Option number C, patient. Next question is, according to Indian Pharmacopoeia, an elixir contains 42% volume by volume alcohol. What is proof spirit? You can pause this particular for this particular question because you need time to solve the question. Apply the formula of proof spirit, solve the question, and then resume the video and check your answer. So here options are 71.8, 72.8, 73.8 or 74.8. And the correct answer is option number C, 73.8. Next question is, dash is an enteric coating material. Options are HPMC, Eudragit RS, CMC or CAP. The correct answer is option number D, CAP. Next question is, the purpose of seal coating in sugar coating process for tablet is. Options are to prevent moisture penetration into the tablet core, to round the edge and build up the tablet weight, to impart the desired color to the tablet, or to give luster to the tablet. The correct answer is option number A, to prevent moisture penetration into the tablet core. Next question is, BCG vaccine is a type of. Options are killed bacterial vaccine, live attenuated bacterial vaccine, killed viral vaccine, or live attenuated viral vaccine. So correct answer is option number B, live attenuated bacterial vaccine. Next question is, staph is which type of bone? Options are longest bone, smallest bone, funny bone, or strongest bone of a man. The correct answer is option number B, smallest bone. Next question is, which of the following part of the heart pumps deoxygenated blood to the pulmonary artery? The options are left ventricle, right ventricle, left atrium, or right atrium. And the correct answer is option number B, right ventricle. Next question is, what is found in blood serum that is also in blood plasma? So options are blood cells, platelets, plasma protein, or clotting factors. The correct answer is option number C, plasma proteins. Next question is, what structures attach a muscle to a bone? Options are tendon, fasciculus, sarcomere, and internal intercostal. The correct answer is option number A, tendon. Next question is, the largest organ in the body is. Options are liver, skin, bone, lungs. And the correct answer is option number B, skin. Next question is, which of the following enzymes are found in saliva? Options are pepsin, trypsin, ptyalin, chymotrypsin. And the correct answer is option number C, ptyalin. Next question is, melatonin is secreted by. Options are hypothalamus, pineal gland, adrenal cortex, or melanocytes. And the correct answer is option number B, pineal gland. Next question is, which of the following provides the greatest surface area for gas exchange? Options are respiratory bronchioles, alveoli, bronchial tree, alveolar duct. And the correct answer is option number B, alveoli. Next question is, which of the following is not a mental disorder? Options are psychosis, diabetes, depression, schizophrenia. And the correct answer is diabetes, option B. Next question is, mortality rate means. Options are birth rate, death rate, growth rate, or none of the above. And the correct answer is option number B, death rate. Next question is, a dietary deficiency in the quantity of protein results in. Options are alkaptonuria, marasmus, Richner-Hanhart syndrome, or kwashiorkor. The correct answer is option number D, kwashiorkor. Next question is, anemia is caused due to the deficiency of. Options are iodine, iron, sodium, phosphorus, and the correct answer is option number B, iron. Next question is, the CPR can be done by ABC formula. Here A stands for. Options are artificial, airway, alcohol, or actual. And the correct answer is option number B, airway. Next question is, gram-negative bacteria have. Options are thick layer of peptidoglycan in cell wall, thin layer of peptidoglycan in cell wall, high lipid contained in the cell wall, or none of the above. The correct answer is option number B, thin layer of peptidoglycan in cell wall. Next question is, which viruses are involved in the bacterial transduction process? Options are animal viruses, plant viruses, bacteriophages, or all of the above. And the correct answer is option number C, bacteriophages. Next question is, the causative agent of measles is. Options are HNN1 virus, retrovirus, rubella virus, or RNA paramyxovirus. The correct answer is option number D, RNA paramyxovirus. Next question is, emetic out through local irritation or gastric mucosa is. Options are ipecacuanha, ammonium bicarbonate, both, or none. And the correct answer is option number C, both. Next question is, excess secretion of thyroid hormones results in. Options are hypothyroidism, hyperthyroidism, both A and B, or none of the above. And the correct answer is option number B, hyperthyroidism. Next question is, radiopharmaceutical use in study of thyroid uptake is. Options are K42, CR51, I131, or S35. And the correct answer is option number C, I131. Next question is, which stain paper is used in limit test of arsenic? Options are pH paper, cobalt chloride paper, mercury chloride paper, or none of the above. And the correct answer is option number C, mercury chloride paper. Next question is, pyridine 4 carbohydrazide is the IUPAC name of. Options are thiacetatone, cycloserine, isoniazid, or ethionamide? And the correct answer is option number C, isoniazid. Next question is, tetracyclines are the first antibiotic and are derived from, options are Streptomyces cavis cavis, Streptomyces acidis cavis, Streptomyces turgidis cavis, or Streptomyces aureofaciens. The correct answer is option number D, Streptomyces aureofaciens. Next question is, IUPAC name of ibuprofen is, options are 1,4-isobutyl phenyl propionic acid, 2,3-isobutyl phenyl propanoic acid, 2,4-isobutyl phenyl propanoic acid, or 3,4-isobutyl phenyl propanoic acid. Now the correct answer is option number C, 2,4-isobutyl phenyl propanoic acid. Next question is, phenoxybenzamine acts as, options are directly on alpha receptor, by irreversibly block alpha receptor, by form ethylene iminiamine, or all of the above. And the correct answer is option number D, all of the above. Next question is, the factors affecting drug absorption are, option A is pH of GIT, temperature of GIT, both A and B, or none of the above. So the correct answer is option number A, pH of GIT. Next question is, factors affecting the drug distribution are, options are drug interaction, disease state, obesity, or all of the above. And the correct answer is option number D, all of the above. Next question is, the example of sublingual drugs is, options are nitroglycerin tablets, paracetamol, aspirin, or atenolol. The correct answer is option number A, nitroglycerin tablets. Next question is, which beta adrenergic blocker has additional alpha blocking properties? Options are propranolol, levotalol, carvedilol, or both B and C. So the correct answer is option number D, both B and C. Next question is, which of the following is leukotriene antagonist? Options are montelukast, gefurlukast, both A and B, or none of the above. The correct answer is option number C, both A and B. Next question is, which of the following drug is potassium channel opener? Options are verapamil, diltiazem, nifedipine, nicorandil. The correct answer is option number D, nicorandil. Next question is, which of the following is class 2 antiarrhythmic drug? Options are quinidine, propranolol, amiodarone, diltiazem. The correct answer is option number B, propranolol. Next question is, patient is not breathing, heartbeat may or may not be present. This stage is known as, options are analgesia, excitement, surgical anesthesia, or medullary depression. The correct answer is option number D, medullary depression. Next question is, which of the following drug is 5-alpha reductase inhibitor. Options are anastrozole, finasteride, tamoxifen, triptorelin. The correct answer is option number B, finasteride. Next question is, which of the following non-narcotic agents is salicylic acid derivative? Options are phenylbutazone, ketamine, aspirin, tramadol. The correct answer is option number C, aspirin. Next question is, spironolactone is a prodrug and its active metabolite is, options are desmethylspironolactone, canrenone, acetylspironolactone, or none of the above. And the correct answer is option number B, canrenone. Next question is, antidote for warfarin overdose is, options are protamine zinc insulin, protamine sulfate, vitamin K, or none of the above. The correct answer is option number C, vitamin K. Next question is, optic neuritis is chief adverse effect of, options are INH, isoniazid, pyrazinamide, rifampicin, ethambutol. The correct answer is option number D, ethambutol. Next question is, an, an organism which has been implicated as a possible cause of chronic gastritis and peptic ulcer is, options are Campylobacter jejuni, Escherichia coli, Helicobacter pylori, Giardia lamblia. The correct answer is option number C, Helicobacter pylori. Next question is, mechanism of action of ondansetron is, options are muscarinic receptor antagonist, histamine H2 receptor antagonist, histamine H1 receptor antagonist, or 5-HT3 receptor antagonist. The correct answer is option number D, 5-HT3 receptor antagonist. Next question is, route of administration for heparin and warfarin is, options are IV and oral, SC and IM, oral and IV, or none of these. The correct answer is option number A, IV and oral. Next question is, which of the following includes primary source of information? Options are pharmacopoeia, abstracts, original articles, or reference books. The correct answer is option number C, original articles. Next question is, Sinahal is the secondary source database which focuses on, options are biomedical sciences, nursing and allied health literature, biomedicine and health, or toxicology. The correct answer is option number B, nursing and allied health literature. Next question is, dash ulcers result due to destruction of mucosal barrier. Options are duodenal, peptic, gastric, or rectal. And the correct answer is option number C, gastric. Next question is, drug induced diseases are also known as, options are teratogenicity, iatrogenic diseases, idiosyncrasy, or none of the above. The correct answer is option number B, iatrogenic diseases. Next question is, what is the antidote for caffeine poisoning? Options are dimercaprol, ethanol, esmolol, or naloxone? And the correct answer is option number C, esmolol. Next question is dash is used for treating the withdrawal symptoms of opioid. Options are methadone, carbamazepine, phenobarbital, or valproic acid. And the correct answer is option number A, methadone. Next question is dash is the percentage which the number of stomata forms to the total number of epidermal cells. Options are vein termination number, stomatal number, palisade ratio, or stomatal index. The correct answer is option number D, stomatal index. Next question is coca and senna leaves have dash stomata. Options are parasitic, diacytic, anisocytic, anomocytic. And the correct answer is option number A, parasitic. Next question is Thalloquin test is used to identify. Options are Syncona, strychnine, datura, or ruver. And the correct answer is option number A, Syncona. Next question is castor oil is obtained by cold expression from the seeds of. Options are Plantago, M. plexicolis, Aloe africana, Rheum palmatum Linn, Ricinus communis Linn. And the correct answer is option number D, Ricinus communis Linn. Next question is ginger is the rhizome of. Options are Piper nigrum Linn, Gingiva officinale roscoe, Ferula foetida, Myristica fragrans Houghton. And the correct answer is option number B, Gingiva officinale roscoe. Next question is nutmeg belongs to dash family. Options are Scrofulariaceae, Myristicaceae, Combretaceae, or Leguminosae. And the correct answer is option number B, Myristicaceae. Next question is Goat's thorn is the synonym of. Options are Tragacanth, Lanolin, beeswax, olive oil. And the correct answer is option number A, Tragacanth. Next question is linseed oil is extracted from dash seeds. Options are flax, quinoa, hemp, or psyllium. And the correct answer is option number A, flax. Next question is wool fibers are made up of dash protein. Options are fibroin, tubulin, keratin, myosin. And the correct answer is option number C, keratin. Next question is tulsi is the dried leaves of. Options are Commiphora viti, Ocimum sanctum, Catharanthus roseus, Myroxylon valsama. The correct answer is option number B, Ocimum sanctum. Next question is deposition of fat on elbows, buttocks, and tendons is known as. Options are xanthelasmus, xanthomas, angina, arcus corneal. And the correct answer is option number B, xanthomas. Next question is Millen's test is given only by proteins having dash in their molecule. Options are tryptophan, glyoxylic acid, cysteine, or tyrosine. And the correct answer is option number D, tyrosine. Next question is, which of the following is a component of the coenzyme A? Options are retinol, pyridoxine, retinoic acid, or pantothenic acid. And the correct answer is option number D, pantothenic acid. Next question is, vitamin A is also known as, options are calciferol, retinol, cholecalciferol, or provitamins. And the correct answer is option number B, retinol. Next question is, dash enzymes is used for the diagnosis of muscular dystrophy. Options are GGT, SGPT, amylase, or aldolase. And the correct answer is option number D, aldolase. Next question is, dash is required for the synthesis of clotting factors 2, 7, 9, and 10. Options are vitamin K, vitamin A, vitamin C, or vitamin D. And the correct answer is option number A, vitamin K. Next question is, dash is the most common form caused due to deficiency of clotting factor 8. Options are hemophilia B, hemophilia A, hemophilia C, or hemophilia K. And the correct answer is option number B, hemophilia A. Next question is, normal mature erythrocytes are disc shaped biconcave cells which do not have, options are nucleus, cytoplasm, cell wall, or lysosome. And the correct answer is option number A, nucleus. Next question is, who is responsible for evolving educational standard and regulations for the course in pharmacy through education regulations? Options are Education Act, Pharmacy Act, Drug and Cosmetic Act, or Indian Patent Act. And the correct answer is option number B, Pharmacy Act. Next question is, in India, the pharmacy education to obtain a degree of Bachelor of Pharmacy B.Pharm initiated at, options are Banaras Hindu University, Punjab University, Madras Medical College, Allen College of Ahmedabad. And the correct answer will be option number A, Banaras Hindu University. Next question is, insulin injection according to Schedule P should be stored. Options are at temperature 2 to 8 degrees Celsius and it must not allow to freeze, at temperature which not exceed 5 degrees Celsius, and at temperature which not exceed 20 degrees Celsius, or in cold place. So the correct answer is option number A, at temperature 2 to 8 degrees Celsius and it must not allow to freeze. Next question is, Schedule J is related to, options are GMP, curable diseases, list of diseases and ailment which drugs cannot claim, or pack size of drug. So the correct answer is option number C, list of diseases and ailments which drug cannot claim. Next question is, chapter 4 of narcotic drugs and psychotropic substances deals with, options are authorities and officers, offenses and penalties, procedure, or preliminary. So the correct answer is option number B, offenses and penalties. Next question is, Narcotics Commissioner should work under the guidance and supervision of the options are PCI, consultative committee, central government, or state government. The correct answer is option number C, central government. Next question is, the annual increment in the maximum retail price is carried out based on the increase in the options are wholesale price index, ceiling price, retail price, or price list. The correct answer is option number A, wholesale price index. Next question is, all the pregnancy terminating admission register should be destroyed on the date of expiry of dash from the date of last entry. So options are 5 years, 4 years, 2 years, or 3 years. And the correct answer is option number A, 5 years. So with this, we are done with the 80 MCQ questions. So you can calculate your marks, mention your marks in the comment. If you feel any question is displayed wrong, if any question is wrong, then you can give 1 mark extra to that particular question to yourself. So that is the basic thing in any of the exam. So you can give a +1 marks for that particular answer which is mentioned wrong. It is maybe spelling mistake or any other thing, so that you can skip and give extra mark to that, and then you can calculate the marks out of 80. Mention in the comments, compare your marks with your friends, share with your friends this particular video, so that they can also have a mock test for this particular exam. And that's all for this video. We'll meet in the another video. Till then, thank you very much.